Welcome to our first video update of the year. So welcome to 2022. We're looking forward to a happy and healthy new year. For this video, once again, we're joined by our infection preventionist expert, Margie, who will be sharing a wealth of information with you and keeping you up to date on what's happening at our facility and throughout our community in ways that you can continue to stay safe. So thank you once again for spending a few minutes to learn from us.
The Omicron variant, we are seeing less time from the time that somebody is exposed to the time that they're showing symptoms, 1 to 2 days in some cases, and recovery time is less for people who have been vaccinated. It's more easily spread from person to person, and we're thinking it's because it's staying in the upper airways, so it's closer to the nose and mouth where it's being expelled a little bit more. It's contagious 1 to 2 days, and we're still looking at this, but possibly 3 days from the start of symptoms. This is one of the reasons possibly that quarantine times have changed. Stopping the spread of this virus and its attack is what our goal is, and we need to make sure that we are taking our recommended vaccines and boosters so that we stay healthy. The Omicron variant is milder for people that are vaccinated. For somebody who's vaccinated, this doesn't mean that they won't get it. It just means that they will probably have a better chance of surviving it. For people that are unvaccinated, they're not protected, so they still could become very sick. The vaccine is still doing what it was intended to do, and that's to prevent infection in many people and to prevent critical illness in so many. We're seeing this firsthand in the patients in the hospital. Those who are unvaccinated have been our sickest patients. Someone who is infected with this virus could very well be carrying it but not show outward symptoms. Doesn't mean that they can't give it to somebody unknowingly. You might hear somebody say, I got COVID, but I wasn't around anybody that was sick, and this is what happens in those cases. Remember, you don't have to have outward symptoms in order to be able to transmit it to someone else. Having the actual disease is when someone has those true symptoms, the fever, the headache, or sore throat. The research is showing that booster shots is really helping us keep some of this infection at bay and really reducing the critical illness of some. We've seen this with other vaccines in the past. When we think about smallpox and measles and polio, those vaccines worked when people took those vaccines. For some people, they have antibodies that will last for greater than 6 months. For other people, they just don't have the antibodies that stay with them very long, and they need that added protection. We know that people that are older don't have the immune response that someone who is healthier has. The CDC now is recommending that children ages 5 to 11 that have some immunocompromised conditions take that additional dose of Pfizer. Until we have a high vaccine number of people, we are going to continue to see this virus thrive, and we're going to continue to have problems and see people get sick. As much as this has been so widespread through the United States, we're probably all going to be exposed to this at some point, but that doesn't mean that we're going to get sick from it. Some people think, well, as long as this is a milder version of the virus, I'd be better off to get this. I'll build up some immunity. This is the time that I want to get it. And it's never a good idea to catch a disease like this. This isn't a common cold. This is a life-threatening disease. It's a disease that has long-term effects for many people. Their heart, their lungs, their kidneys, has put people out of work. They can't return to work, or they have to, if they do leave the hospital, they leave home on oxygen. With the increase of the number of people that we've seen in the hospital, if you need a hospital bed, that's not saying that there's going to be a bed here available for you, just because of the way we've had our census so high with so many sick people. If you could follow a healthcare worker to see what is happening with these COVID patients, you would not want to intentionally get this disease. For both inpatient and outpatient, our aim is to reduce the virus and to boost the immune system. Treatments can be different for different patients just because they may have different presenting symptoms, their oxygen levels are different, they may or may not need to be mechanically ventilated. For hospitalized patients, we're using remdesivir, and this is an antiviral. There are some studies that are showing the use of remdesivir could maybe mean earlier recovery and earlier discharge from the hospital. There are also other complications that go with this disease that need to be treated while a patient's here. They could have effects to their heart or their lungs or their kidneys that require different medications. We are using antibiotics, we are using steroid inhalers, vitamin C, L-lysine, zinc, probiotics. These are all things that boost the immune system, and we're using those inpatient and outpatient. For people who are not sick enough to be in the hospital, we're using monoclonal antibodies. These are an outpatient infusion. We are using bamlanivimab in a combo, and we call it BAM-EDI, and it's FDA authorized. It helps a patient to respond more to the virus effectively, their immune system. There are also two new oral medications. One is developed by Merck and one by Pfizer. And they are not available yet in hospitals, and only certain pharmacies have them, and they are based on age and weight of the patient. The Omicron variant seems to be affecting those under 5 with a harsh cough, much like that croupy cough that you hear kids get from flu or the seasonal viruses like RSV. COVID is also giving them that cough, and again, because it's staying in the upper airways for them. Little children have little airways, and it doesn't take much for those airways to get inflamed and give them some problems with breathing. So the best thing that we can do for this age group is to vaccinate and booster the adults that are around them.
Since our last video a few weeks ago, we've continued to experience very high volumes, or a high census as we refer to it, which is a lot of patients that are being hospitalized and needing intensive care. It's been a challenge over the past several weeks as we're starting to learn how contagious this new variant of the Omicron virus is for us. So we've learned to adapt the best that we can. We've reopened our acute respiratory clinic to be able to see patients in an environment that is not within our regular practice settings, to hopefully help isolate those that are symptomatic. We've also had to open an additional intensive care unit to try and support those patient care needs. One of the things that I'm excited about is that we're beginning shield testing, which was developed by the University of Illinois, and we're able to offer that to the public on Mondays and Thursdays. And there's more information that you can find about shield testing on our website at www.fhn.org. So we continue to battle the pandemic, and we are nowhere near getting through this as of yet. So our focus is trying to keep well and to help people stay healthy. There's a number of challenges that hospitals are facing. Not only are we still dealing with the continued effects of the first few surges, as we're looking at a new challenge is we have less of a workforce to be able to respond with. So the healthcare workforce was short-staffed before the pandemic, and the coronavirus has certainly emphasized the need for healthcare professionals. It's been a difficult time, Again, this virus has decimated our workforce with people exiting healthcare, which leaves a very strained healthcare workforce left to try and care for individuals. And healthcare workers are not immune from the effects of their families becoming ill or they themselves becoming ill, which further exacerbates the difficulty in trying to provide staff. We're also seeing that with this new variant, with how contagious it is, many more patients of various ages are needing hospitalization or intensive care. And that continues to create that larger burden, coupled with supply chain disruption, which makes it even more difficult. I think the general awareness is that the pandemic persists and the demand continues to grow, yet our ability to meet that demand continues to diminish without much more public support or a more robust healthcare workforce. The way that FHN is coping with these challenges is trying to do what we do best, which is focus on our communities and to focus on the families that we're caring for. We've also looked at different options that we can put in place to be able to help meet that demand. So I mentioned earlier in the video that we expanded our intensive care unit to a second unit. Now that has allowed us to care for more patients, and we have the ability to expand that to a third potential intensive care unit, although our challenge will be staffing. However, we've met that response. We've also opened some additional support for our provider offices, such as our acute respiratory clinic. We've partnered with the University of Illinois once again to offer shield testing, making that widely available. We are continuing to offer initial vaccination clinics as well as booster clinics, and we're looking to do all we can to support our healthcare workforce so that they know that they're appreciated, they're cared for, and trying to do the work that we need to do to keep them well. We've noted that some of the rapid tests that you may be getting over the counter may not be as accurate as the testing that we can do here. And so one of the things that we've done for our workforce is made sure that any of the testing that we're doing is PCR-based testing, which has a higher degree of accuracy in order to better protect our patients and our coworkers. Where it comes to federal assistance, the state of Illinois actually has two federal disaster teams that have been deployed. One most recently in the Chicago area to help support Ingalls Hospital, and then one in the Rockford area at Javon Bay Hospital. Those medical teams are providing staffing for a 12 medical surgical bed unit, which will allow the other local area hospitals to transfer patients to that unit so that they're freeing up bed space or capacity within their organizations. How that impacts FHN is our hope is that if the hospital volume in Rockford is able to be decompressed or able to be expanded, that we will have greater success in being able to transfer patients once we become overfull or overrun with a surge. So it helps to offset some of that pressure for a very specific patient base. And it's very new, so we're all looking forward to see how that can help and how we can best work together with this federal team. One of the simplest explanations is that the coronavirus keeps changing, and as it changes and as we learn more, we get better information on how we can treat and prevent COVID-19, and at the same time, we're learning in real time what's working well, what's not working. And what FHN has done is try to steer clear of rumors, social media, or theoretical approaches, and really go to the most credible, scientifically based resources that we can to make our decisions and to make sure that we adapt and we adjust based on the best information that's currently available. And like anything, the more that we learn, the more we know, and the better we get at battling this disease. The best advice that I have for our community is to stay focused on being healthy, staying well, making sure that you're engaging in safe practices, being aware of how you're feeling as well as how others are feeling, and making sure to support one another. This has been a stressful time for everybody throughout our community, and that stress is starting to show. Many of us are very fatigued with the situation, and we need to be empathetic to our friends, our neighbors, and our families that they're going through this as well. So when you think about what are the things we can do to help support them, to encourage them, and also focusing locally on how we can support our businesses, help our healthcare providers, really offer that encouraging word, and stay hopeful. This is a moment in time, and as challenging as it is, it will pass. And working together is the way that our community will continue to thrive as we get through this pandemic.